Okay, good evening everyone, and welcome to the first part of our webinar series. And just to give you a little background as to this series, our mission at FS Animal Health is to enable a horse to live a healthier life for a longer period of time. And one of the requests we've had from vets is to be able to bring equine health more into focus by not only offering free webinars for vets, but also for horse owners, so that they're not just trying to treat issues themselves, but they actually recognize potential symptoms with their horse and then consult a vet earlier and sooner, so that people are not just making it up as they go along, but they're engaging with their vet earlier. And that's what we really want to do, is bring equine health back into focus and help horses live a healthier life. So a brief background to who FS Animal Health are, for those of you that may or may not have heard of us before. We mainly focus in two brands, Hesterbarb, which is equine nutraceuticals, and Haygain, which is a brand of equipment to give clinical health benefits to horses. And we fit in the circle of care in the segments of feed and nutrition and therapy and management. And I'll briefly go over that. So Hesterbarb and Haygain, they come together with vets. They're vet first recommended products, they're science backed, but they're administered predominantly by the consumer. They relate to an issue, a treatment or prevention of an issue, and they're measured by how effective they are. And the way we do that is, if you take the common conditions, equine health conditions, obviously there's more than this, these are just some examples. There's 4 ways that we're typically seeing these cared for. There's the surgery, you can intervene with medicine, then you've got therapy and management, and feed and nutrition. So for example, there's different types of surgical procedures you can do, different types of medicine that is available, and we put diagnostics under that as well, which is becoming increasingly advanced. Then you've got your therapy and management, can be anything from nebulizing to laser to massage, steaming. Then you've got your feed and nutrition side. Typically, obviously through medicine and surgery, that's administered by a vet or a paraprofessional. With the feed and nutrition or the therapy and management, that's often administered by the horse owner or a paraprofessional. So we're trying to tie this together with through knowledge and diagnostics with what the vets are doing, and then with monitoring and feedback from the horse owner. And that really encompasses the whole circle of care in a horse's life, from gestation right through to end of life. So I'd like to introduce our speaker tonight, which is Emily Floyd. Emily is a very qualified vet. She's a clinical director at Rossdale's in Newmarket, RCVS recognised specialist in equine medicine, and a diplomat of the American College of Veterinary Internal Medicine. Joined Rossdale's in 2009, became a partner in 2016, and a clinical director in 2021. And she has a very keen interest in veterinary dermatology. And just before I hand over, you'll see the Q&A section. If you fire any questions you've got into there, we'll either answer them as we go along, or we'll do it at the end. So with that, I'll pass over to Emily to take it away for our webinar tonight. Thank you.
Thank you very much, Bruce. Right, let me just share my screen for you. Can you give me a thumbs up, Bruce, if you can hear me all right? Perfect. Okay. So I'd just like to say, firstly, thank you very much to Bruce for inviting me to speak tonight. I'm obviously very delighted to be partnering with Pharmastable to talk about omega-3 fatty acids tonight. As Bruce said, I'm a vet at Rossdale's, and I've been there for a long time now. I'm getting quite old. But over the years, my interest has sort of veered through all aspects of internal medicine to having much more of a focus in dermatology. And that's when we're talking about topics, I thought this is an area of interest for myself, and actually something that probably we would all benefit from knowing a bit more about. So this is the outline of what I'd like to talk through. And I guess it's very important that I sort of declare that coming at this, I am not a scientist, I'm a clinician, as I assume most of you watching tonight also are. And so I'm looking at this from the very clinical perspective. You know, what role do these compounds have in my veterinary practice? You know, I'm not a scientist, so I apologize if the science background of this is perhaps, you know, maybe if I gloss over some areas of it. But this is what I want to talk about. What exactly are the omega fatty acids? What are the compounds? Where do they come from? How do they work? And then I want to look at what their role in normal health is. So what's their role in the health of a normal individual? And then perhaps where can we push that to looking at the role of these compounds in disease? Then we're going to talk at the end a little bit about the different sources of fatty acids, where do they come from in terms of different resources in the world. And then as clinicians, how do we, when we look at a supplement or when our clients come to us with a supplement, how do we assess what's in that and what are the things that we should be looking for, which are going to improve efficacy for our horse clients? So what are the omega fatty acids? Well, they're a big group of compounds, actually. They're a group of fats, and they have many different roles in the body. And this is just a list of some of the main ones. They're essential nutrients, so they have some nutritional value for a start. They also provide energy. They allow absorption of fat-soluble vitamins, but they also have many other important roles, which is where our interest as vets really comes in. So they are able to modulate inflammation and the immune response. They are a very important structural part of the cell membrane, which has important things when we think about the function of the cell membrane. And they also have other important functions, like they're important in growth and development, and more obvious things like skin and coat health. And they're broken down into these two groups, the omega-6 compounds and the omega-3 compounds. Now, I apologise for this to start with, because this is taking us back to school chemistry. And when I went to refresh this, I'm not going to lie, I didn't remember it at all. So just bear with me for a moment. But when we think about the fatty acids, they are all basically triglycerides. And if you remember back to school, which, like I said, I didn't, triglycerides are made up of these fatty acids with glycerol at the end. And they basically consist of a chain of carbon atoms which are bonded to hydrogen ions. And the reason when we talk about saturated fatty acids or monounsaturated fatty acids depends upon whether or not each of those carbon compounds, which are the little white dots, have a friendly double hydrogen atom with them. And if some of those hydrogen atoms get replaced by a double bond, that changes how the fat's classified. So you see in that middle picture, we've seen that one of those double bonds has been replaced, so that makes it a monounsaturated fatty acids. And if you're starting to lose multiple of these hydrogen atoms, it becomes a polyunsaturated fatty acid. So that's all fine and well and good. How does that relate to the omega-3 and 6s? Well, that is how these compounds are classified. So if you look at this, this is just the chemical compounds of the omega-3 and the omega-6s. And really the reason they're classified as they are is that location of that first double bond. So you can see on the top picture, the omega-3s have that first double bond at the third carbon atom, and the omega-6s, it's at the sixth carbon atom. And that's just why they're classified as they are, which is basic, just the background as to why they're called different things. So when we think about breaking these compounds into the omega-3 and the omega-6 groups, we're basically going to think about these main compounds. And so I apologize, there are quite a few terms here. These are really the 5 compounds that we're going to talk about through the whole course of this half-an-hour session. So if we think about breaking them down into the omega-3 group and the omega-6 group, and we'll come on to the importance of the relative different groups in a minute. But when we think about the omega-3s, the 3 compounds that we're really going to think about are alpha-linoleic acid, or ALA, eicosapentaenoic acid, or EPA, and then docosahexaenoic acid, or DHA. And for the sake of making it easier for everyone, I'll use the abbreviations from here on in. But these are the real compounds that we think about. And when we think about which are the compounds which have the most profound effect, it's these compounds, EPA and DHA, that we're tending to think about that have the most profound effect in the horse's body. If we think about the omega-6 compounds, well, the parent compound is linoleic acid, or LA, and the main metabolite of that is arachidonic acid. And if we think about what we also know about many of the other pathways we think about, so things like nonsteroidals, that's a compound that we recognize, don't we, in terms of being part of many pro-inflammatory processes. So we'll come back to that. But these are the main compounds we're going to be thinking about. So in the omega-3 group, the parent compound is ALA, and then the most potent compounds it's converted into are EPA and DHA. And then in the omega-6 group, it's linoleic acid, LA, and then arachidonic acid, or AA. So that's just showing you that. And what's really important when we think about how the horse gets these compounds is that the top parent compounds, so ALA and LA, cannot be generated in the horse's body. So they're considered to be essential fatty acids. They are compounds that have to be provided to the horse in the horse's diet. The horse is not, or humans, other mammals, we do not have the capacity to generate those compounds in our body. So they are compounds that have to be provided either through a supplement or through the horse's natural ration. What's also important, and we talked already about how the compounds that we tend to focus on are EPA and DHA, is that these compounds are converted in the horse's body and through a combination of enzymes. So there's a whole group of enzymes which are elongase and desaturase enzymes, which convert these compounds down into these other compounds. And what's important to think, and we'll come back to this multiple times during this talk, is that actually those enzymes are shared between both these groups. So there's basically one set of enzymes that convert these essential fatty acids into their other compounds. And they are shared between the omega-3s and the omega-6s. So they don't have separate pathways. They are working on the whole combination of these essential fatty acids to convert them to these downstream processes. So we'll just think for a moment about the alpha linoleic acid, or ALA. So I've already said that we think predominantly that EPA and DHA are the most potent anti-inflammatory compounds. And, when you're looking at your own fish oil supplement, that's certainly what will be listed on the bottle. But there actually is also some evidence that ALA has some of its own important mechanisms in the body. So we're going to focus a lot about the impact of EPA and DHA and what they can do, but actually there is increasing evidence that ALA is itself important. And so we're not going to talk about that a lot, but just to mention that now, and there's been a number of studies now showing that actually this compound itself can have some immune modulating responses in the body. So the next thing we want to think about is we're obviously recognizing what compounds we're worried about, and we recognize which compounds we're looking for in the body. Where do they naturally come from in the horse's diet? Well, the good thing from the perspective of horses is that actually these essential fatty acids are really abundant in a normal horse's diet. So both forage, which is preserved, or grass turnout, they are both extremely high in these parent compounds. So there's a large amount of these essential fatty acids in the horse's diet. So it's very unlikely for a horse that we are dealing with to be deficient in these compounds in the first place. The other really good thing about horses is, as we're going to focus more about thinking about how the benefits of omega-3s, but actually the alpha linoleic acid is really predominant in horse forage. So a horse is going to get a naturally really high supply of these if they're having any good quality turnout or good quality forage. If we think about where else these compounds come from in the horse's diet, if we're thinking about trying to directly supply these compounds, the ones that we talked about already being important, so EPA and DHA, really the only way to directly supply them without the horse making it in their own body is to supply that via marine-based supplements. So I've obviously showed you a picture of some fish there. There are some other marine sources, so things like seaweed and algae can also do it, but you have to supply this. If you're trying to supply these products directly, you have to supply it through some of these compounds that the horse would not naturally be exposed to in their normal diet. The other way that we can supply these compounds is in a variety of different oils, and this is the way that horses would also be commonly exposed to these omega fatty acids. And if we look at the different oil types on the left and the right, you'll see that the oils which we think about that we would supply in some instances to horses that are high in omega-3s. The main one that has a high omega-3 ratio is linseed, which is exactly the same as flax. We just use those terms interchangeably. There are other oils too, which have a pretty good omega-3 content compared to omega-6s. So things like camelina oil, and then other products like canola and soy oil, which we perhaps supply less frequently. But linseed would certainly be the most common, and that would have the best omega-3 content of those different oils. Then when we think about products which are high in omega-6s, which are probably things that we are less keen to supply in huge volumes, these are the oils which are really high in omega-6 compounds. And again, they are definitely things that we would supply to horses. So, as vets, if we're trying to add calories, we'll often tell clients to add something like sunflower or corn oil to the diet just to add calories. But one of the side effects of doing that is that we're actually also supplying a really large amount of omega-6s. The other thing that really changes this ratio is provision of concentrates. So horses in the wild would actually obviously not have exposure to concentrate feed, but nearly all the concentrate feeds that we provide to horses are relatively high in omega-6s and low in omega-3s. So they are pushing us in that direction of the omega-6 compounds. And why do we care so much about this? Why should we all take our fish oil supplements in the morning? Well, this is why it's important, because actually omega-3 compounds have really important anti-inflammatory effects in the body. So the metabolism of these compounds produces all of these different compounds, so things like resolvins, protectins, eicosanoids, and they generally, in a very simplistic way, promote an overall anti-inflammatory effect in the body. And in contrast, when we think about these omega-6 compounds, they basically have the opposite effect. And we talked, didn't we, about the arachidonic acid and that being a compound that we're used to thinking about. But these are some of the metabolites of the omega-6 compounds. So all these inflammatory compounds, things like prostaglandins, thromboxanes, leukotrienes, and eicosanoids again. And the overall effect of these compounds is obviously one of a pro-inflammatory state. And that's why we care so much, because if we're trying to promote good health in normal body function, but also if we're trying to manipulate this to help us if we have a disease state, then obviously what we're trying to manipulate is we're trying to avoid this pro-inflammatory swing and push the horse into this anti-inflammatory state. Now, obviously, it's like everything in life. We talk about all the different processes, things like coagulation and inflammation. We need a balance. So it's obviously not that we don't need any omega-6s. These compounds obviously have important functions in the horse's body, but the balance is important. Overall, we need the correct ratio of these compounds, and we want the ratio to be pushing us in more of an anti-inflammatory rather than a pro-inflammatory direction. And there is some evidence that if you really push this too far, you can have adverse effects. So things like lipid peroxidation, platelet aggregation. So we don't want to push this to the extreme, but certainly pushing the horse in the direction of the anti-inflammatory state is generally what we're trying to achieve. So there's a lot of talk about the ratio, the ratio of this omega-6 to omega-3s. And this is just a graph that I took out of something from human literature, looking at what the ideal ratio is. And in humans, they suggest that the optimal ratio is somewhere between 5 to 1 to between 5 to 1 and 1 to 1. Now, they always display this ratio of omega-6s first. So it's always should be the omega-6 always comes first, which to me is slightly confusing. But anyway, we're looking at a ratio in humans somewhere between 5 to 1 to 15 to 1. But with the Western diet that we commonly consume, it's estimated that the vast majority of people are consuming a ratio which is much closer to something like 15 to 1 or higher. Now, what ratio do we want in horses? Well, the answer is we don't entirely know, but probably similar to the low end of what humans have. And actually, a horse in a natural state where they're consuming only forage will have a ratio which is very close to 1 to 1. So that's presumably what we should be aiming for if we're trying to manipulate this. So just to show you an example of the ratio in some of the different feedstuffs that we would commonly feed. So if you look at the top, this is all the forages, and on the right is that omega-6 to omega-3 ratio, the N6 to the N3 ratio. And if you look at the normal forages, so different grasses and different hay types, you can see how low that ratio is. And that's really, again, highlighting the fact that actually, these products have a really good ratio. They are already pushing us into this anti-inflammatory state. But then you look in contrast at some examples of the different concentrates that we might feed, and you can see that they are really high in omega-6s compared to omega-3. So they're really pushing that ratio in the wrong direction. And I think, especially as someone who does a lot of medicine, we often think about, trying to avoid starches in horses' diets. So we're thinking about, providing high fat feeds to horses often, to try and prevent that real starch effect. But some of these compounds, things like rice bran, are actually still really high in omega-6s. So from that particular aspect of the feed, you're maybe not, necessarily benefiting this part of the horse's pathway. So this is a human side, again, obviously looking at what pushes the ratio in humans. So if you're really healthy and you eat lots of, the correct oils and lots of fish and walnuts, then you're going to be eating a lot of omega-3s. But as soon as you start consuming things like sunflower oil, junk food, so the other products, you're going to be tipping your omega-6 ratio. Now, most of the horses we know don't go to McDonald's, but again, what are the things that tip horses in this direction? And it's very simple, again. Horses that are provided with a large amount of concentrate feed. And again, if you think about many of our performance horses, they're automatically being pushed into this camp, even if the feed is relatively high in fat. Also, this potentially could be a problem in horses which don't have access to good quality turnout or don't have good access to, good quality forage. And again, if we're providing large amounts of these omega-6 heavy oils in the horse's diet. So they're the things that we're worried about where we are altering this ratio, not in our own interest. So that's if we think about health. What about role in disease? So we've said already that the omega-3s have these potential anti-inflammatory roles, and that actually has many potential benefits in many disease states. And these are just a few of the areas which have been studied. And we're going to run through some of the studies which have evaluated omega-3s in some of these different disease conditions. But potentially any pro-inflammatory disease, these compounds may have a use. So if we start by thinking about osteoarthritis, and the first thing I guess to say is that there are multiple studies that show that supplementing with omega-3s can increase concentrations of both EPA and DHA in the site where we want it. So in the synovial membrane, in the cells lining the synovial membrane. So we're at least confidently able to say that these compounds are likely to get to the site of interest. Overall, the trend from these osteoarthritis studies suggests that when we're using fish sources compared to the plant sources like the flax sources, that they've been able to achieve higher concentrations of these anti-inflammatory compounds in the synovial membrane. And when I talk about these studies, I'm going to show you, I've just put down as a sort of overview what amount of omega-3s were supplemented in the basis of it, because there's a lot of conflicting evidence about how much omega-3s we need. So in this study, they used 40 grams a day of a mixture of different omega-3s, and they looked at what effect it had in experimental synovitis. So they basically had a different group of horses. Some they fed omega-3s to, some they didn't. And then when they induced an experimental synovitis in these horses, they then looked at what the difference in immune response was. And interestingly, in these horses, they were able to show that the omega-3 group did have some modulation of that inflammatory response to the experimental stimulus. This is a study which looked in a slightly more clinical setting, so looking at omega-3 supplementation in standardbred trotters. And they looked at a whole range of things in this paper, but supplementing directly with DHA, they were doing about 6 grams a day, was associated with an increased trot stride length in standardbreds. And they looked at a whole lot of things that weren't significant, but there was some suggestion that actually this supplementation did have an effect on basically mobility and a difference in stride length. So showing that this possibly does have some effect, maybe improving lameness and comfort. And then finally, this third study I'll just touch on is this is, again, a natural situation where this is horses that had naturally occurring arthritis, and they were fed omega-3 supplement over a period of time. A combination of EPA and DHA, actually a fairly high amount in this study. And what they found in this study was that they could identify changes in the different groups, that these horses had decreased white blood cell counts in the synovial fluid, and also decreased inflammatory markers. There was changes in the prostaglandin concentrations, but they weren't able to identify an overt change in lameness. And I think that's probably one of the take-home messages of the use of omega-3s, is that actually these compounds are very likely to have an effect if you use them correctly, but they are probably always going to be adjunctive measures. So, they're probably unlikely ever to be enough that if you have a horse that has really bad arthritis, you're never going to alleviate the need to have any other types of pain relief or other management strategies. But if we're thinking about additional things which are going to have some additive effect, that's where these compounds have a role. This is the area which actually I think probably has the most excitement for me, obviously being a medicine person, but looking at these compounds in metabolic disease. And again, this is a real big area of research in humans, with the massive obesity epidemic, but with horses, we all know that we were basically having a similar level of obesity epidemic in horses. And we worry so much, don't we, about metabolic disease and laminitis. And we know that obesity is a pro-inflammatory state, and that one of the big problems with that is, especially in horses, when we think about laminitis, is that these pro-inflammatory cytokines interfere with the insulin signaling cascade. And actually, there's good studies in humans and mice and rats experimentally showing that using these omega-3 fatty acids, you can actually improve insulin sensitivity. And there's lots of reasons why that might be. These compounds are incorporated into cell membranes. They can improve membrane fluidity. They can improve glucose transport function. They can improve insulin binding. And they can also increase expression of GLUT4 transporters. So actually, these compounds really have quite a promising role when we think about these areas. So what's the evidence out there supporting their use? So this is a study where they used a DHA algal supplement, about 16 grams a day. And they found in this study that the horses that they treated with the omega-3s had significantly lower triglyceride concentrations, so a real measurable effect, and that there was some evidence, although it wasn't significant, that there was also reduced levels of inflammation, and they measured that by TNF-alpha concentrations. Also, interestingly, in this study, they did an oral sugar test and looked at insulin response. And in the untreated horses, they were able to identify that these horses had an increased insulin response, which was basically mitigated in the horses that had received the omega-3 supplement. So again, showing a real tangible difference in these horses with metabolic syndrome. This was a different but sort of fairly similar study looking at the effect of fatty acid supplementation on insulin sensitivity. So this is an index of insulin sensitivity. There's the 3 groups here, so you can see the controls are the one on the left, the marine supplements, so that's where they're directly supplementing EPA and DHA, and then the plant-based, the flaxseed supplement, is the 3rd column. And they looked at this at different time points. And again, you can see that supplementation of these horses improved insulin sensitivity, which actually increased with time. Interestingly, in this study, they actually found that the flaxseed group was basically equally, if not slightly more effective than the marine supplement, which is interesting. And that's not a trend that's followed in all studies, but certainly in this study, they found a real improvement in insulin sensitivity with supplementation, and it was slightly better in the plant-based supplement. And then just finally, one more study we'll just touch on. This is a study where they, again, did a fairly similar thing, where they were challenging horses with a high starch diet. The supplement in this study actually contained a few other things, which I've listed there. But again, they were predominantly supplementing with EPA, that should say DHA. And again, they were finding really tangible improvements in insulin markers of insulin regulation. So they found these horses had improved glucose clearance rates and also reduced insulin concentrations at 75 minutes in the glucose insulin tolerance test. So moving on to what other areas we might think about. The next area where I think these products really do have a role is looking at things like respiratory disease. Now this study has been around for a while, but actually this was a study where they looked at using an omega-3 supplement to try and provide additional benefit to horses that were already having fairly good management for equine asthma. So these were horses that were already on a low dust diet. They were fed only pelleted feed. They didn't have any hay exposure, but they were horses known to have basically chronic asthma. They tried different concentrations of the used EPA, and again, they had some of the compounds that they were supplementing with. And in this study, they found that the asthma horses showed not only improved clinical scores, but also improved airway neutrophilia compared to horses that were not supplemented in an otherwise identical management setting. And I'll just take one excerpt from this paper. If you look at the neutrophil percentage in BAL fluid, if you look at the placebo, the untreated horses, they had a neutrophil percentage of about 11 before, which increased to 17 after. In the treated horses, they had slightly higher neutrophil percentage at the beginning, 23, but a real tangible difference. The neutrophilia percentage went down to 9% in the treated horses. So again, not just an indication of clinical improvement, but also an indication of improvement at the cellular level. Skin disease, and I think this is an area where fatty acids really do have an important role. We know fatty acids have this really important role in skin barrier function for the start, and that they also can decrease pro-inflammatory mediators. And when we're thinking about a lot of the inflammatory conditions that affect equine skin, one of the big problems with horses that have allergy is that we're getting this immune response, which is driving towards the Th2 response, which we see in atopy. And actually, these compounds can help modulate that immune response away from that Th2 response, which is obviously what we want. And this has been extensively researched in humans. And actually, there are some fairly good studies looking at this in dogs. And in dogs with atopy, there are studies showing that supplementation can reduce clinical scores, so give clinical improvement. But not just that, but they can also reduce the dose of other medications that's required for maintenance. And again, that comes back to what we've touched upon already. I think these compounds often aren't the only answer, But if you have a horse that has severe atopy and you can half their steroid dose because you're using additional omega-3s, then that has to be a real benefit. And, there obviously is some cost implication of using some of these omega-3 compounds, but actually if you're thinking about your clients and their requirement for veterinary medicines, we know that things like prednisolone are really expensive. If you can halve the horse's steroid requirement, you're going to offer that client, not just a reduction in side effects for the horse, but also a positive financial benefit. Sadly, the studies in horses in terms of skin are not so extensive. There's good evidence that these supplements get to where we need them in the skin, so they increase concentrations of EPA and DHA in the skin. There's one study looking at topical omega-3 cream, which there were some problems with this study. I think some of the other compounds they mixed with it were probably quite inflammatory, but this is a picture of that horse that they treated, and you can see it did have quite a significant improvement in the severity of the skin lesions. It didn't reduce pruritus for these horses. And there's one other study looking at flaxseed supplementation in an experimental model looking at reactivity to midge bites, so midge antigens, and showing that there was some positive benefit. This is not science-driven at all, but just to show you an example of how I think these compounds can be really useful. This is a horse I've been treating for a long time. She's a thoroughbred broodmare who has a diagnosis of pemphigus, so she has immune-mediated skin disease. And you can see on the left, she has quite extensive scaling and crusting, and these symptoms are very difficult to control. That have required quite a lot of management over time. And this horse now we are able to manage. This is her just a few weeks ago on the right. And you can see that actually, although she's not without any steroid medication, we're managing in her basically 0.5 mg per kg of preds, the equivalent dose every day, with the omega-3 supplement. And we can really appreciate when they try to stop the supplement because it's a pain to give extra medications, we really see that the steroid requirement for this horse increases. Again, coming back to that thing that I think, as an adjunctive measure, these products are really useful. So finally, what about performance? Can we use omega-3s to make horses run faster, jump higher, whatever sport that we're looking at? And I mean, there are many potential performance benefits of omega-3s. So, we've talked about how these products can improve cell membrane fluidity, they improve insulin sensitivity, which obviously is really important for metabolic health and performance. That potentially helps improve muscle function. And again, these supplements have been shown that, if you give these supplements, you can increase these compounds in red cell membranes. So there's loads of studies looking at different things. I'm just going to show you two, but just again to show that these products can cause a tangible effect. So this is an exercise-driven study where horses were on a treadmill. These horses were supplemented with 30 grams a day of omega-3s. And this is just one excerpt from this study looking at heart rate at exercise. And you can see that the horses in the fish oil group had a significantly lower heart rate during the exercise phase compared to the horses that were not supplemented. This is a cool study that came out of JAVMA, again, looking at a different aspect of performance. So this is looking at omega-3 supplementation and the relative prevalence of squamous gastric ulcers, so naturally occurring gastric ulcers in exercise thoroughbreds. So in this study, they supplemented with a fish-based supplement and also a flax-based supplement. They found that the fish-based supplement was more effective at increasing plasma concentrations. They were supplementing in the fish group about 10 grams a day of omega-3s. And what they found in this study, it was a significant reduction in naturally occurring gastric ulcers. So again, if I just show you one little excerpt, this is the three groups, so unsupplemented and then supplemented on the right. And you can see that the ulcer prevalence was significantly less in these horses that were supplemented with the fish-based omega-3s. So you're pleased to hear that's enough papers for us for this evening. But again, there's plenty of other areas where these compounds have been examined. So there's plenty of interest and research into looking at their effects in reproduction. So in terms of semen and egg quality, lots of interest in looking at behavioral things. And that partly comes, I think, from humans where, we worry a lot about omega-3s in pregnancy and in early childhood and the effects on cognition and intelligence. And so there's some studies evaluating that in horses. And again, some studies evaluating the effect of omega-3s in terms of colostrum quality and obviously foal growth and development. So coming full circle to us as clinicians, and I guess the first question that we should always ask ourselves is, do I need to supplement? And I think For me, I would really break this down into 3 areas. The first group would be these horses on the left. So this is a horse that doesn't do very much. It doesn't have a lot of concentrate feed. It doesn't have a high performance workload, and it's clinically healthy. And you can see it's consuming a lovely lush green pasture. In the winter, it has good quality forage. Well, the answer for these horses is they probably don't need supplementation, provided they're not having large amounts of concentrates pushing their omega-6 concentration up, then actually they probably have no requirement for supplementation at all. And their natural diet is going to be providing them with a good healthy ratio of omega-6 to omega-3s. The middle group of horses is obviously a group of horses that we deal with all the time. And this is horses with clinical disease. And this is a horse that has really bad atopy, that deals with really severe pruritus. But again, it's these chronic pro-inflammatory diseases. So horses with asthma, definitely. Horses with chronic skin disease, yes. Horses with metabolic disease, potentially also these horses with chronic arthritis. This is a group of horses where I think we actually really can manipulate this in our favor. And actually there's quite good evidence that omega-3 supplementation is going to offer these horses a potential benefit. And then the third group of horses is horses that are expected to perform at a high level in whatever performance they are being expected to do. And I think the biggest part of this actually is really looking at often what we're doing in terms of supplying these horses with large amounts of concentrates, we're supplying them with large amounts of omega-3s. So again, I think this is a group of horses where there is really a good indication that supplementation may be beneficial. So how do we supplement? Well, the first thing that we really need to do is to think about the base diet, because we've talked already, haven't we, about how the enzymes which convert those compounds to the more active compounds are all dependent on the same enzymes. So the efficiency of that process will depend upon what the total ratio of the diet is. So again, if you have a horse that's predominantly feeding forage and pasture, which is naturally high in omega-3s, then again, they probably don't need to be supplemented. As soon as we start providing lots amounts of concentrates, lots amount of bad fat, basically, we're going to be increasing the production of these pro-inflammatory compounds. And again, what's the optimum ratio? We're probably aiming for a ratio of close to 1:1, or probably no more than 2:1. So how much do we need? Again, it really depends on how much you are supplying to the horse in general. So again, if you're feeding the horse absolutely loads and loads of concentrate feed, which is really high in omega-6 compounds, you can't possibly expect feeding that horse 50 mils a day of a supplement of even really potent omega-3s to counteract that. So it has to be put into the context of the horse's diet. But looking at summarizing all those different studies together, I think this is a fair assessment of when you're looking at a supplement, this is basically the amount of omega-3 content that you want to be looking for to be expecting an effect. And it does depend on what the source is. So probably around 10 grams a day if you're looking for a marine source, which again, we've talked about the direct supply of those more potent compounds, or if you're supplying a plant-based source, so you're supplying flax, for example, which is high in that compound ALA, that's requiring the horse to convert that into those more potent compounds. The rate of conversion is not that clear in horses. It's probably not that efficient. You're definitely going to need to be supplying more to hope for a similar sort of effect. And probably reasonable to say you're hoping to supply maybe about 30 grams a day of a plant source. So then, when you're looking at your supplement and you're saying, you're contemplating supplementing this horse, the question is, do you want to supply it in a plant-based form, or do you want to supply it in a fish-based form? Well, there is some conflicting evidence about the relative efficiency. And again, we don't know the exact conversion rate of ALA to these other compounds. And we've talked again about the fact that these enzymes are shared. So there's a competitive effect. So the amount of conversion we're going to have is going to be dependent on the overall diet composition in the first place. But I think it is in general fair to say, based on all these studies, that the most profound effect is likely to be seen if you're providing a marine source, which are naturally higher in these more potent compounds. Now, that doesn't mean that we always need to do that to have the effect, but I think if you're really looking to be really having the most profound effect, you're probably more likely to see that by directly supplying a marine source. But that raises questions in itself. So if you're thinking about doing that, you're thinking about supplying a fish-based supplement to the horse. Obviously, that's not a natural thing to do. Horses would never naturally eat fish in the wild. And it comes with quite significant environmental and probably ethical considerations. So if we consider what the human requirement for EPA and DHA is according to the World Health Organization, we already know that the global fish supply cannot supply that. So I don't know, and I don't know the answer to this, but I just raised the question to you that, you know, maybe it's not ethically the right thing to do to be providing fish sources to companion animals. You know, these are all things we worry about in terms of environmental impact, you know, overfishing, harm to other marine organisms, habitat destruction, pollution, they're all major concerns. And also the energy cost of fish oil production is very high because of the requirement for fish harvesting, storage, processing. So probably the other alternative to this, if we're trying to supply these marine-based, more potent compounds, is thinking about newer technology and things like algal sources. This is a really cool picture of an algal farm in New Mexico. And there's an increasing interest in doing this now, where actually, you know, commercially farming algae or seaweed or different marine products, which are naturally high in EPA and DHA, but can be farmed much more sustainably. And actually, probably from the environmental impact, this is something that we should probably be promoting in terms of supply of these compounds. And then we certainly can supply these products in plant sources. So on the left, this is linseed or flax, which is the product that we think most commonly about supplying in the UK. This is a picture on the right of camelina, which is a crop that's gaining in sort of interest in the States as an alternative crop that can supply these compounds. And, you know, the horse does have the ability to convert these compounds, the high amount of ALA in these plant-based compounds, into some of these more potent compounds. Just the efficiency is not so great. But, you know, this is what the horse is naturally designed to eat, these plant-based sources. So perhaps this is a more logical way to be supplying them. The other just practical considerations when you're thinking about these products for your clients is that actually these compounds are inherently unstable. So they're prone to oxidation, so heat, light, oxygen exposure, prolonged storage. And the effect of that is that they will decrease in their nutritional value, the oil can become rancid, can also generate harmful compounds. And obviously, you know, if you're expecting your client to pay, you know, additional money for these compounds, there's no point providing them with a really high potency omega-3 oil if they have nowhere to store it that's not going to be at 30 degrees and it's not going to immediately become rancid. So obviously technology will help. So there's all these different processes which help to make these compounds more stable. So things like encapsulation, antioxidants can help. So you want to, when you're looking at these supplements, look at what technology is in place, what's the shelf life of these compounds, what are the storage recommendations, to see if it's feasible that you're going to be able to feed these compounds and store these compounds sensibly. So just when you're thinking about these supplements, critically evaluate the quality of it. Think about where they've come from, you know, likely duration of storage, what's the ongoing shelf life, what's the formulation. And again, think about what your client's ability to store it is going to be. You know, if it needs to be kept at a specific temperature, you know, make sure that your client is able to do that in the environment that they're in. So just to summarize, the good news is if we're thinking about healthy horses that are receiving good quality forage or turnout, then they are likely to be receiving a very adequate supply of the essential fatty acids, so ALA and linoleic acid, and they are probably not in a market where they're necessarily going to need supplementation. But there are lots of areas where actually supplementation is likely to have a beneficial effect, so certain life stages or certain disease states. If you're supplying a plant-based supplement, it's going to be supplying that parent compound ALA, which is going to be converted into those more potent compounds via desaturase enzymes. If you really want bang for your buck, then probably supplying these compounds directly is more likely to have a profound effect. And you will do that by either supplying a fish or an algal-based supplement. When you're looking at the supplement, make sure you're evaluating the amount of the fatty acids, the source of the fatty acids, and also there's more practical things, so shelf life, storage, stability. So I'd just like to say thank you to Bruce and Daniela from Farm Stable for asking me to give this webinar today. I hope it's been useful. They've got some great omega-3 products, so have a look. If you've got questions, I'm sure Bruce will answer them. And then just as a final shameless plug, I just want to let you have a little bit of information about this. This is something really cool, unrelated to horses that unrelated to work that I'm doing, which Farm Stable have really generously donated some sponsorship for. And this is a really cool ride next February called Ride to Independence, associated with my friend Steph Quintrell, who's disabled. You can see her in the picture in a wheelchair. She has her own company called Equine Adventures, And next February, we're going to ride across the Andes. So it'd be really cool if you can follow our adventure. Here's the tags on here. So if you Google Equine Para Adventures, you'll find us. You'll find us on Instagram, and just follow us along. We're going to do some really cool stuff. And that's me. So thank you very much for your attention. I think, Bruce, are you going to maybe man the questions if there are any?
Yeah, thank you, Emily. That was absolutely excellent. Genuinely, that was really, really interesting. And I appreciate your insight into that. I'd also like to say as well, from our perspective, yes, we supply the Omega products, but what I really liked is a couple of times what Emily mentioned is they do have an impact, they do have a part to play, but it's not going to be the only thing. And that's really important when, as vets, is that building confidence with the horse owner. We want them to reach out to you earlier. We want them to be speaking to you earlier. And, people think a supplement's going to fix everything. If you look at the feeding pyramid, it starts with your forage, get that right. Then you might need your hard feed or your balancer, and it finishes with the supplement if required. But there is more to that. So we've had some great questions come in, Emily. I'll read them out, and some of them are quite long.
Oh,
So
God. I'm a bit scared.
yeah. So the first one here, since omega-3s are good for insulin and horses with laminitis, how should they be incorporated into the diet of horses with metabolic diseases and laminitis, given that they're fats and calories and these horses are on a strict diet?
Yeah, it's a great question, isn't it? Yeah, great question, really practical question. I think actually that's where these products obviously are very fat dense, that's true, but you're actually supplying quite a small amount. So I think that's how you have to look at it, that actually if you're looking at the actual calories you're supplying, especially if you're using a more potent supplement, the actual calorie benefit is, calorie addition is not going to be that great. If you're using a supplement where you're supplying, just a few, I don't know what it is, 30, 60, 90 grams, depending on what formulation you're using, actually the calorie addition to that is not going to be that great. So I probably wouldn't worry too much about it. And again, we're really in those horses, aren't we? We're trying to focus on predominantly forage and then really no concentrates at all if possible. And that's when we're going to get the most profound effect from these compounds anyway, because we're not offsetting that ratio. So that would be how I would look at it.
That's great. And thanks, Emily. That's a good answer to that. And it's a really practical question as well. And in relation to the forage, just picking up there, you mentioned it again. And is there really good forage analysis for the omega-3s to 6s? You put some data up earlier. Is that quite easy for horse owners to get?
Well, the answer to that question is I really don't know, actually. I'd have to find out for you. Certainly can get back to you. That was a research publication. And actually, as far as I know, when we're looking at places like where we'd send our forage to Eurofins and things, I don't know if they provide that, but I certainly could look into it.
Yeah, that's a great point. Yeah, and we can also speak to Ruth Bishop. She does quite a bit of work on that,
I think
which is
actually in
helpful.
general, though, the more I think about that, actually, those compounds, those types of foraging grass are actually naturally quite high in omega-3s anyway, though. So I think probably actually the investment in terms of measuring it's probably not that good. And actually it's much more important to think about what supplemental feed you're giving to those horses.
Yes, okay, that's great. The next question is, if you're wanting to feed a linseed supplement, does it need to be oil or can it be linseed powder?
Again, it's going to ask me loads of sciencey questions. The answer is, I think again, that's coming back to some of the technology. I think it doesn't need to be an oil. And actually the benefit of some of these powders is that that's where technology helps, doesn't it, improve stability? And you can help
Yeah.
me out with this, Bruce.
Yeah, I would say it's more important to know the analysis of that product
Yeah,
because you could get a good quality oil or a good quality powder. Know
yeah,
what the breakdown and the ratio of that is, personally, I'd say, and then how much you're feeding of it.
yeah.
There's another question here. Do you have any experience with supplementing omega-3 fatty acids to horses with IBD? Is there a potential effect on mucosal barrier integrity or local immune function?
Love this question too. If you ask any of my colleagues, basically they won't be able to think of a disease where I don't think about recommending an omega-3. So actually, yes, I would definitely, again, it would be a pro-inflammatory disease where I would definitely think about doing it as an adjunctive thing. To my knowledge, I don't know in horses if there are any studies looking at that, but actually I would suspect that there is some effect, but I don't know that it's that well researched in horses to this point.
Yeah, okay. There's another one here, also from the point of view of stability. the importance of opaque packaging and storing any feedstuffs that are rich in oil in a cool place away from direct sunlight. Yeah, I think that's a critical point as
Yeah,
well, Emily. I think it's more of a
very good
statement
point.
from this vet
Yeah.
there. So we've got one here, which is a caseload, a case from a client. I'm currently working with a 7-year-old gelding that has struggled a lot to gain healthy weight and has been labelled as slow to mature and prone to being sensitive after prolonged hard work. He's fed hay and mixed grains, history of soft or softer feces, and increased urination for the past few years. The owner would like him to gain more weight and wanted to switch out mash for corn, but would it be better to feed linseed?
So
If that's a bit much to take in one go, we can always
yeah.
answer it afterwards, Emily.
Yeah, so what I think actually my main point about that would be actually that would be the sort of case where I would be definitely reaching out to some of my nutrition colleagues and friends who love to hear from me regularly, because actually you're really wanting to look at the overall balance of that diet. So I think specifically from the point of view of omega-3 to 6s, yes, linseed definitely would be beneficial, and if you're feeding a reasonable amount, that can add calories. But actually you're probably not going to be able to feed enough linseed on its own to solve all those problems. So that's where you probably do need the help of a nutritionist who can look at the omega-3/6 ratio in the context of how you're going to provide the other calories to that horse.
That's great. That's really good, and I definitely back that up. Get your paraprofessionals involved. Get that home team really sorted. A good nutritionist, good vet can make a massive difference to that. We've got another question here. Before we move on, it's again it's a bit of a long one here. At the beginning of the presentation, soy was in the omega-3 category, but isn't it richer in omega-6? What's your opinion on giving soy as a protein boost to metabolic horses with laminitis? But a lot of people are skeptical because there are a lot of things on the internet that strictly prohibit giving it to horses that have laminitis due to omega-6. Soy is considered an excellent source of lysine. It's very affordable. Can 100 grams of soy really have that much impact on the whole condition?
Oh, that's another great question. I would again be reaching. So you're absolutely right that soy, and actually, if you look at when I put that slide up, which had the omega-3 versus 6s on different sides, soy's right at the bottom because actually it's of the oils. If you look at the ratios, it's sort of in the middle. So it has high, it has high. I think it's maybe 6 to 1. So it's certainly not as good. Flax is like, I don't know, closer to 1 to 1. So it's not the best, but it's also not the worst. So again, it's putting it into the context of the whole thing and going back to that thing about the fact that you need those same enzymes to convert all the different things. So 100 grams of soy, you're right, probably isn't going to have that much impact in the big scheme of things. But again, it's going to depend on how that fits into the balance of the whole ration.
Yeah, that's a great point. There is a lot. I mean, this is a great question. There's a lot out there on the internet about um, sort of the anti-soy brigade, but actually, soy has got great benefits from a protein level. And there is actually a great point which I can share after this, doing some work recently with Ruth Bishop, and she was going through the way that soy, is part of the legume family, where it's actually coming down, the benefit of soy at the end of it. Any potential issues with it are broken down right early on in the process of processing soy. So it is an affordable product, great source of lysine, as mentioned, but I think again, 100 grams soy, what's the concentration of that as far as the omega-3s the horse is actually ingesting? So that I think brings us to the end of our questions for now, Emily. Any more we can answer afterwards. Again, that was a stunning 45 minutes. I really appreciate that. And I'd also like to back up as well. Please do follow the charity ride she's doing in February. It is an incredible ride. I was trying to explain it to somebody today, and they couldn't believe how they were going to be undertaking it. Please do. Any sponsorship will help them. It is a really, really good cause, and there is a ton of great photos, some really good information out there about what they're doing, and also what some of the teams already done.
And I'm not a
So
very good rider, Bruce, so I'm likely to fall off. So you've got to have sympathy from that perspective.
I certainly do, especially if we go over the Andes. Good. Well, thank you very much indeed again, Emily. I appreciate that. Thanks everyone for coming on, and we will see you again.
Thank you very much. See you later.
Goodbye.